Superficial therapeutic heat. In this section, we will include the examination of superficial therapeutic heat modalities.
Heat is the increase in molecular vibration and cellular metabolic rate. Heat is produced by four primary methods: the transfer of thermal energy, chemical action associated with cell metabolism, mechanical action such as found with therapeutic ultrasound, and electrical or magnetic currents such as those found in diathermy devices. Superficial heating agents heat a larger area of tissue, but they also have a limited depth of penetration, a little less than 2 centimeters. To produce therapeutic effects, superficial heating agents must be capable of increasing the skin temperature to 104 degrees Fahrenheit to 113 degrees Fahrenheit, or roughly 40 to 45 degrees Celsius. The physiological effects of heat are opposite than those of cryotherapy. The cellular response of thermotherapy results in an increased cellular metabolism, increased demand for oxygen, and may result in an increase in the amount of secondary injury in the case of acute injuries. As far as the inflammatory process, thermotherapy will result in accelerated inflammation by increasing the inflammatory mediators and by increasing the cell permeability. This also results in a facilitation of soft tissue repair. The effects of heat on the blood and fluid dynamics include immediate vasodilation, decreased blood viscosity, increased blood flow, increased edema with the capability of removing edema. This increase may result in a loosening of the edema. Nerve conduction is also affected by the use of heat in thermotherapy as well. Heat helps increase nerve conduction rates, decreased mechanical pressure, and reduces ischemia. There is a picture of ischemia in the bottom of this slide. Ischemia is a local and temporary deficiency of blood supply. Heat also helps activate large diameter neurons via the gate control mechanism and decreases pain sensations. Muscle spasms and muscle function are also affected with the use of thermotherapy. Heat helps to alleviate spasms by decreasing the sensitivity of the secondary gamma afferents and increasing blood flow to the muscle. These effects result in an increased range of motion by elongation of the collagen-rich tissue, for example, muscle, tendon, and fascia. It could also possibly increase the strength of the muscle. The indications or why we would use a treatment for thermotherapy include subacute or chronic inflammation, subacute or chronic pain, subacute or chronic muscle spasm, decreased range of motion, joint contractures, which is pictured below on the left, and hematoma resolution. The contraindications or why we wouldn't use a treatment for thermotherapy include acute injury that's less than 72 hours old, compromised circulation, compromised sensation, advanced arthritis, fever and pregnancy. We want to avoid systemic heating, thrombophlebitis, which is pictured below on the right, and DVT, which is pictured below on the left, tumors and infections. There is a table for the indications and contraindications listed within Table 5-7 on page 127 in the Starkey text. The magnitude of heating effects is based on the temperature increase of the target tissue. Mild heating is associated with 1 degree Celsius or 1.8 degree Fahrenheit, which is utilized for mild inflammation and accelerated metabolic rates. Moderate heating is associated with 2 to 3 degrees Celsius or 3.6 to 5.4 degrees Fahrenheit increases, which is utilized for decreasing muscle spasm, decreasing pain, reducing chronic inflammation, and increasing blood flow. Vigorous heating is associated with 3 to 4 degrees Celsius, most commonly 4 degrees Celsius or 5.4 to 9 degrees Fahrenheit, which is utilized for tissue elongation, scar tissue reduction, and inhibition of the sympathetic activity. The information on this slide can be found on page 128 within Table 5-8 within the Starkey text. Too much of anything can result in an opposite reaction of what's intended. With cryotherapy, by cooling the surface of the skin and underlying tissues, ice causes the narrowing of blood vessels, a process known as vasoconstriction. This vasoconstriction can lead to a decrease in the amount of blood being delivered to the area and subsequently lessen the amount of swelling. After a number of minutes, the blood vessels reopen or dilate, allowing the blood to return to the area. This phase is followed by another period of vasoconstriction. This process of vasoconstriction followed by dilation is known as the Hunting response. Although blood still flows into the areas, the amount of swelling is significantly less than if ice is not applied. This decrease of swelling or edema allows more movement in the muscle and so lessens the functional loss associated with injury. The swelling associated with the inflammatory response also causes a pressure increase in the tissue, which leads the area to become more painful. This pain is intensified by certain chemicals that are released into the blood when the tissue is damaged, hence the vasoconstriction from applying ice to decrease pain. With thermotherapy, when maximum vasodilation has occurred and the intensity of the treatment stays constant or increases, the vessels begin to constrict. This is known as rebound vasoconstriction. This occurs approximately 20 minutes after treatment. It causes vasoconstriction after prolonged vasodilation and a way to save the deeper tissues by sacrificing the more superficial tissues. Mottling of the skin is a warning sign that tissue temperatures are rising to dangerously high levels. In this case, ghostly white areas and beet red splotches mark the patient's skin. When mottling occurs, the treatment should be discontinued immediately.